Hi everyone, my name is Tyler Newell and I'm a current fourth year medical student at UAB who trained at the Tuscaloosa Regional Campus. I'll be presenting a project that I've been involved with for the last 8 months titled Using Self-Measured Blood Pressure Monitoring to Increase Hypertension Control Among Priority Populations using MAP, which stands for Measure Accurately, Act Rapidly, and Partner with Patients. So let's get started. Approximately 50% of adults with hypertension do not have adequate control of their blood pressure, and treatment of hypertension is the most common cause of healthcare provider visits and long-term medication use in non-pregnant adults. Self-monitoring blood pressure may lead to improved blood pressure control, especially when paired with supportive interventions. So this is a case report of a patient that I enrolled in the study. This patient is a 51-year-old male. He's married. He's a non-smoker. He has employment-based health insurance. His chronic conditions include uncontrolled hypertension, hypercholesterolemia, and sleep apnea. He agreed to participate in the study, and he was provided with a blood pressure cuff and educational materials at enrollment. His physical activity is limited by his job, but he denies problems with obtaining or taking his medications. Patients are screened for uncontrolled hypertension, which is defined in this study by a measurement of greater than 140/90 on 2 separate occasions. If they agree to participate, they're then provided with an automatic sphygmomanometer and educational tools at enrollment. They're also given a booklet with information on smoking cessation, lifestyle modifications, and dietary changes and how that can improve blood pressure control. They're then asked to measure and record their blood pressure daily for 3 months. The data is collected via phone call every 2 weeks for those first 3 months of enrollment. After that point, their blood pressure will be recorded at a routine 6-month and a 12-month clinic visit. So I have a graph here that shows the mean arterial pressure over the initial 36 days for this patient, which we used to establish a baseline. The initial data analysis showed an average blood pressure of 150/90. The average mean arterial pressure is 110. And again, this is the data that we're going to use to establish the baseline for this patient. And we'll continue to collect and trend data as part of the final data analysis. I think this project shows the importance of supportive interventions in hypertension control. Previous studies have shown that self-measuring blood pressure can lead to improved blood pressure control, but the goal of this study was to evaluate the effectiveness of self-measuring blood pressure when paired with telemonitoring. Challenges of the study include participant availability and reporting of accurate data. This patient appears to be more proactive in managing his hypertension. He often reports lifestyle changes such as increased exercise during these phone calls. Supportive interventions may be useful in future practice as a way to improve quality of life and lower the pill burden for patients with hypertension. A question that I had is that if supportive interventions such as these can help with accountability and help patients make healthier decisions and gain control of their blood pressure, could it also be applied to other chronic conditions such as diabetes? I think this could be an area for possible future research. The study also serves as an educational tool for the students involved. It gives medical students experience in managing hypertension. It raises awareness about common obstacles patients face when attempting to gain control of their blood pressure. It also allows students to establish a relationship with a patient and monitor progress over time. I called this patient on a biweekly basis for 3 months to collect his data and discuss his goals. I had 2 interactions with him in the clinic and 4 more via telephone. And with each subsequent encounter, he appeared to be more engaged in gaining control of his blood pressure, and he was often excited to report increased exercise and dietary changes. I think this has been a very valuable experience for me, and many of the other medical students involved in this study have reported the same thing. So I have the references listed here. And then I also wanted to give a thank you to the residents of the Tuscaloosa Family Medicine Residency Program and Dr. Jared Ellis for their contributions to the project. Thank you.